Hi, welcome to Tooth Talks by Esthetix Dental. I am Dr. Sridhar Reddy, prosthodontist and implantologist. Today we are going to discuss about dental scaling. What is scaling? Scaling is tooth cleaning done by a professional dentist. So many people ask me what is the difference between a regular cleanup and brushing, and what is the difference between scaling and brushing, or regular tooth cleaning by a professional and brushing we do at home. Brushing, which is a mandatory procedure everybody does at morning and night, but that is not enough to maintain your oral hygiene. Regular tooth cleaning done by a dental professional, which is called scaling, is extremely helpful to maintain the dental hygiene, to avoid bad breath and gingivitis, gum swellings and various dental problems. Not only does scaling clean up the teeth, but it will also strengthen the gums and the bone below. And also we discover any initial problems which can be intercepted early and to avoid expensive dental procedures later on. It helps basically in identifying all other dental problems at an early stage so that it will avoid future expenses, and also it will save a precious natural structure. So there are many questions about scaling. People ask me, why dental scaling? Why do we have to do every 6 months when we brush daily? It is not the same. Brushing and scaling is not the same. Supposing if you buy a car, you clean it daily but you service it only once in 6 months. If you don't service it, it will go for a toss at some point of time. So similarly, scaling and brushing is different. Brushing has to be done morning and night every day, but there are some plaque particles which deposit on the tooth surface inside, and they don't come out with brushing. So it has to be done by a dental professional, and it is called as scaling. There are many myths about scaling. People ask me, why do we have to do scaling? And many people ask that teeth become very sensitive and the gaps should be created in between the tooth, and also tooth would get abraded and damaged by scaling. It's not true. Scaling has to be done once in 6 months according to all World Dental Organizations. But if scaling is done once in 10 years, 20 years or 15 years, suddenly all the deposits are removed at once, then you'll have a lot of sensitivity gaps in between the teeth. The gaps are created only because the existing deposits are removed, but tooth is not removed. You obviously bound to have sensitivity for a few weeks, or 2 to 3 days, or carrying on to 1 or 2 weeks, because it has been done after a very long time. This can be avoided if it is done at a timely interval of 6 months each. And also there are other myths of scaling called, once you start scaling, then it has to continue always. Of course, every 6 months it is recommended, and you have to brush morning and night daily, which is different from scaling, and scaling has to be done once in 6 months. And people also are conscious about the cost of the scaling, but it is nothing compared to the preventive procedures which you discover early in life and which will lead to much worse procedures later on. So all of you, I would recommend strongly that once in 6 months get your scaling done and dental checkup done, which will lead to a healthy dental life. Thank you.